Well, to shed more light on this, we have the pleasure to have this phone with Dr. Islam Anan, lecturer of pharmacoeconomics and health policy, faculty of pharmacy, Ain Shams University. Good afternoon, sir.
Hello, good afternoon.
Good afternoon.
I'm happy to be with you as well.
Well, Doctor, now with this good news that Egypt is on the path of eliminating the hepatitis C virus, what's your comment on this, and what is the importance of this achievement?
Okay, perfect. As the marvelous introduction you mentioned, and just yesterday, our President Abdel Fattah al-Sisi received the golden tier status on the path to elimination of hepatitis C, and a big celebration last night attended by the WHO officers and the principal general director, as well as all the representatives. It was actually a big milestone. And I believe first we need to define what the golden tier that we achieved. So the WHO, the World Health Organization, they define the gold tier as achieving the programmatic requirements to facilitate the reduction of hepatitis C infection and death to levels that enables Egypt to eradicate hepatitis C epidemic. Of course, it's a global disease, and currently we are talking about around 60 million people suffering from hepatitis C. However, Egypt managed from the start of 100 million healthy lives, and even from 2014, to diagnose 87% of people or Egyptians living with hepatitis C. And actually the WHO requirements was only to diagnose 80%. And also we provided treatment to 93% of those diagnosed with curative treatment. And we included the curative treatment, which is all manufactured by local manufacturers here in Egypt, which is again another milestone to celebrate. We exceeded the WHO gold tier, as I mentioned. And even from a treatment perspective, the WHO threshold was only 70% treatment of diagnosed people, and we achieved more than 80, which is 93%. Of course, as you mentioned, the journey we had from having one of the world's highest rates of hepatitis C infection to being on the path to eliminate it completely in less than 10 years is actually astonishing. And Dr. Tedros Adhanom, the Director General of WHO, last night, he actually said, in quotation, and I quote that it is an exemplary case study for Egypt that we achieved with modern tools and political commitment, the highest level, to use these tools to eradicate and save lives. Of course, the transition from being number one to having prevalence of around 0.38% prevalence in only a decade is a big achievement, and hence the celebration that we got, and being the first country worldwide to celebrate the road to eradication of hepatitis C is an achievement that we need even to build on for the another and the rest of presidential initiatives you mentioned in the introduction to achieve our goal by 2030 of having an Egyptian citizen centricity of health that's not only treating diseases, but we are promoting health of all individuals to prevent diseases from happening at the start.
Yes, Dr. Hanan, also there was a very big role played by the Egyptian state, of course, and the presidential initiatives that was launched in the past years. And among them is the 100 million health. Give us an idea about the efforts that are exerted by the state and the presidential initiatives for boosting the health in Egypt in general, and especially the hepatitis C.
So if we are talking about the presidential initiatives in general, we are talking about 14 presidential initiatives between early detection and prevention of different diseases, and as well promoting health in many initiatives. If we look at the initiatives, we will find that it takes the full journey of the Egyptians. So we start with the Mother and Fetus Presidential Initiative, for example, taking care of pregnant women, the delivery, and then the newborn screening, and even before that, the premarital screening and the counseling for the parents during the first baby. We do have the 1,000 Golden Days presidential initiative as well that was launched just a couple of months ago, taking care of the first 3 years of our newborns till we reach school children. Then we do have the anemia, the short stature, which is the stunting, and the obesity presidential initiatives. We do have the national nutrition strategy, and then going to even non-communicable diseases like hypertension and diabetes, and ending with the other non-communicable like cancer initiatives, and even for geriatric care and taking care of our senior citizens. So it takes the full journey of the Egyptian population from birth till adulthood till senior years. And the main focus of all the presidential initiatives are to make sure that we do have better health for Egyptians, and we are not just reactive and waiting for any disease to emerge and then trying to see whether we can actually treat or not. Giving one example is breast cancer, for example. We suffered from an 18% prevalence of breast cancer among all cancer diagnosed in Egypt, and mainly we were discovering all the cases in late stage. And late stage, which is stage 3 and 4, we are talking about a terminal illness where there's a very high probability that the patient will end up in a terminal case and in palliative care. So after the presidential initiative, the Women Health Presidential Initiative, they screened and early detect for 30 million Egyptian females, and they detected most of the breast cancer cases in early stages. So we made a down stage of 50%. So now we do have 50% more diagnosed in stage 1 or 2, which is a curable stages. So we are actually saving lives by the presidential initiative. We are as well promoting life years and survival. And the last and one of the most important pillars, we are even promoting economic return on investment, because we have a productive person. She's actually handling a family. She's actually working, contributing to the economy. And one of the most important pillars is social perspective. Our mothers, sisters, the female in Egypt are an important labor, but as well an important supporter and a breadwinner. We do have 14% of Egyptian women are breadwinners, responsible for a whole family. So we are saving not an individual, we are saving a family. The catastrophic impact of losing a mother, of losing a sister, of losing a daughter because of cancer cannot be actually measured in money. They cannot be measured in any aspect. And hence, that's one of the examples of presidential initiative. And you can measure this to all the presidential initiatives you mentioned in the introduction, and I mentioned in my statement a couple of minutes ago.
Yes, Dr. Hanan, also the Director General of the World Health Organization said that Egypt is the first country in the world to receive the gold status on the path of elimination of the hepatitis C, achieving in no record, in a record time, achieving in a record time a global success story in the transformation from being the highest terms, the highest country being highest rates of virus C infection, to be the first country in the world to reach this outstanding level of eliminating the virus. So if you can comment on this important phase, please. Sentence. Also, give us an idea about Egypt's being a model now in order for other countries to benefit from Egypt's experience in this field by Egypt organizing conferences or giving the experience it have passed through.
So if we look deeply in Dr. Tedros Adhanom, the WHO Director General statement last night and in general during handing the gold tier certificate, it's actually an excellent case study from all aspects. If we, for example, talking about the resources itself, how can Egypt utilize the full resources of the Ministry of Health, and how the Minister of Health and actually several ministers after succession, they managed to hand over the project from one administration to another, and utilizing the full resources from human power, the training they gave in the primary care, the referral system made from primary care and the screening itself to referrals of the cases being diagnosed to the tertiary care and receiving the treatment there. The treatment itself is a case study, and we all remember how Egypt and the Minister of Health negotiated the price of Sovaldi, and we managed to take it by around 1% of its global price. And then after that, immediately we started even manufacturing the local curative treatment here in Egypt in Egyptian pharmaceutical plant. And if we are talking again about data, how we managed to have a full digitalized system that's capturing the full information of Egyptians being screened. And we are not talking about a small data, we're talking about a very big data. We're talking about 60 million Egyptians being screened in the hepatitis C eradication presidential initiative, which is actually the largest screening ever made for any disease. And then how the program itself and the automation of the system made the patient automatically on the platform to receive their treatment, following them up till succession and having a good response rate. We're talking about a cure rate of 97%, which is even exceeding the global trend in the treatment succession. And the last but not least is tracking the outcome itself and having patients with sometimes cirrhosis and more liver diseases like liver cirrhosis, and putting them in another presidential initiative, which is liver cancer. So even all the patients diagnosed and identified in the HCV elimination program are currently being screened for liver cancer. We are talking about 60,000 patients, and currently we are giving even the liver cancer treatment again for free for all the patients eligible for treatment.
Yes.
And finally, from economic perspective, it was calculated that each pound Egypt spends on the HCV elimination program returned as around 2.5 Egyptian pounds return on investment for the Egyptian economy.
Yes, I thank you very much for your time. I really had the pleasure to have this phone off with you. Thank you for your valuable information, Dr. Islam Anan, lecturer of pharmaceutical economics and health policy, faculty of pharmacy, Ain Shams University. Thank you very much for joining us over the phone. Ladies and gentlemen, a short break and I'm going to be back with you.